welcome to your personalized deep dive. Looks like you've been exploring AI in French healthcare. Yeah, applications, challenges, all that. France is doing some really interesting stuff, so get ready for some surprises. What really stands out to you in all of this, expert speaker?
It's fascinating to me how systematic they're being. They're really building an entire infrastructure, not just, trying to slap AI on every problem they come across. It's like data privacy, ethical development, targeted investments. They're really thinking it through.
Yeah, I was reading about their national AI strategy, and it seems pretty ambitious.
Oh, definitely. It launched back in 2018, and it's not even just healthcare. It's like they want AI to benefit like all of society. But healthcare is a big part of it.
And the Health Data Hub, that's like at the core of it all, right? A
Yeah.
giant database for research and innovation. I mean, that's got to be a data privacy minefield.
It is. It's a massive undertaking. So the Health Data Hub, this platform, it's designed to store and share anonymized health data, securely, of course. So researchers can then use this data to train AI to find new treatments and spot population health trends. But yeah, you're right. There were some initial concerns about data protection.
Yeah, well, I mean, balancing progress with privacy, that's always tricky.
Always, always.
So how are they handling that? Is it all just, good intentions, or are there like actual safeguards in place?
Well, France actually has this ethic by design guide specifically for AI in healthcare. It's a framework for developers and researchers to, really think about the ethics at every single stage. Like, for instance, when you're dealing with really sensitive data, like mental health records. The guide helps make sure that these AI tools are designed to protect patient privacy and avoid unintended consequences.
That makes sense, having ethics built right in from the start.
Yeah.
And the EU is also working on AI regulations, right?
Yeah. Yes, the European AI Act. It's coming, and it's going to set rules for, ethical AI development across the entire EU. So, just think about it. If an AI is helping with your diagnosis, wouldn't you want to know that it was, created ethically, that it's trustworthy?
Absolutely.
Yeah.
So beyond just the ethics, what's France doing to encourage AI innovation in healthcare? I saw something about regional calls for projects.
Yeah, so they're putting their money where their mouth is with funding in these specific initiatives. The calls for projects focus on particular challenges, like using AI to improve diagnoses from medical images. There's this cool project in the Bourgogne-Franche-Comté region that uses AI to personalize diabetes management. So it goes beyond just the diagnosis into actual tailored care.
So it's not just about the tech itself, it's about creating a whole ecosystem where it can grow.
Exactly.
And that means dealing with that whole data situation, right?
Right.
We talked about the Health Data Hub, but what else are they doing?
Well, they've got a national digital health roadmap. This thing lays out plans for like electronic health records and better data sharing. They're also funding research projects. Like there's one called Data E, which focuses on creating new ways to actually use that health data. DAE, by the way, stands for Data Analytics and Artificial Intelligence for eHealth.
So basically they're building the information superhighway for French healthcare.
That's a great way to put it.
So the data can flow smoothly and securely. Imagine if all of your health records were digital and easy to access, and could even help research.
Exactly. And that data accessibility is a key part of what makes personalized medicine possible. Speaking of which, we should probably get into some of the specifics of how France is actually using AI to, tailor treatments. So that Health Data Hub, the one you mentioned, that plays like a crucial role in actually achieving personalized medicine. It provides those massive data sets you need to actually train AI algorithms to recognize patterns, make predictions based on someone's unique characteristics.
That makes sense. You need a ton of data to teach an AI about, like all the little things that make someone's health unique. But it's not all just about data, right? France is really big on patient satisfaction, too. I was reading about this program called eSatis.
Oh, right. Yeah, eSatis. So it's a national initiative where, like, patients in hospitals, they fill out online questionnaires about their experience. So it gives the hospitals this valuable feedback, real-time stuff they can use to improve their services and the quality of care.
So it's like a direct line from the patient to the hospital administrators. Helps them understand what's working and what's not. But where does AI fit into all this?
Well, imagine, sifting through like mountains of patient feedback manually. It'd be totally overwhelming. But AI can analyze these giant data sets to actually find patterns and trends that, human analysts might miss.
So instead of just like individual complaints, AI could highlight systemic issues or like areas where some hospitals really excel,
Ah,
right? So they can make more targeted improvements.
exactly. Like AI can spot areas where patients, consistently report negative experiences or where specific hospitals are like always doing better than others. So it allows for more focused interventions and better resource allocation.
It's kind of crazy how AI can apply to, like, not just the hard science of medicine, but also to improving the patient experience.
Absolutely, yeah. It's about using technology to make healthcare more patient-centric, make it responsive to, individual needs.
This deep dive has been packed. We've covered so much, like France's whole AI strategy, ethical stuff, data infrastructure, funding, training programs, the whole 9 yards, and their European collaborations too. It's really impressive.
It really is, yeah. And I think it underscores a really crucial point. AI in healthcare, it's not just about the technology. It's about using that technology to actually empower patients, to enhance the care, and to build a more equitable and sustainable system for everyone.
And while France's approach is pretty impressive, there's some people out there that argue that, like, strict European data privacy laws might actually make it harder to share the data needed for really effective AI. Like, they think it could hold things back. What do you think about that?
That's a valid concern, for sure. It's all about finding the right balance between privacy and progress. It is crucial. And while, yes, these strict data privacy laws, they might pose challenges, they also make us get more creative. Like, we have to be more responsible in how we collect and use data. It encourages us to develop, privacy preserving techniques like federated learning, where the AI models, they can be trained on data that's decentralized without, compromising someone's privacy.
So we're not looking at privacy as like a roadblock, but more like it pushes innovation
Right.
in like data science and AI development.
Precisely. And it makes sure that ethical considerations are like built in from the very start.
We've touched a little on the potential downsides of AI, but it's worth exploring a bit further. What are some of the like challenges and uncertainties that we still need to figure out as AI becomes a bigger part of healthcare?
One of the biggest ones is, figuring out how to regulate this whole thing effectively. It's a field that's moving so fast. We need clear guidelines to make sure, we're balancing innovation with safety and ethics. We want progress, but we don't want to stifle creativity or, put patients at risk.
It's really delicate balance. Too much regulation and you stifle innovation, but too little and who knows what could happen.
Exactly. Yeah. And then, there's the issue of access and equity. We need to make sure that these AI advancements benefit everybody, not just people who can afford it or who live in, certain places. We don't want to make existing healthcare disparities even worse.
That's such an important point. AI has the potential to make healthcare more accessible to everyone, right?
Right.
But we need to be careful that it doesn't actually make the gap between the haves and have-nots even bigger.
Absolutely. And, another thing that worries some people is that AI might be used in ways that take away patient autonomy and choice. So we have to ensure that patients understand how AI is being used in their care and that they have the right to say no if they want.
It's about empowering patients to be like active participants in their healthcare decisions,
Yeah.
not just passive recipients of whatever AI tells them to do.
Right. And then there's the scary stuff. Like, what if AI is used for bad things, like developing autonomous weapon systems or, creating deepfakes that make people not trust healthcare information anymore?
It's definitely something to think about. With any really powerful technology, there's always that risk of misuse. But let's focus on the positive for a sec. What are some of the most like exciting developments that you see on the horizon for AI in healthcare?
Well, one area with huge potential is personalized medicine, or precision medicine, as it's often called. This involves, using AI to analyze a person's genetic makeup, their lifestyle, environmental factors, and then developing treatments and prevention strategies tailored to them.
That sounds like the ultimate in personalized healthcare. Treatments designed just for you, based on your needs and risk factors. So we're talking about a future where medicine is no longer one size fits all, but like tailored to each individual.
Exactly. And we're already seeing early examples of it. AI is being used to develop, personalized cancer treatments based on a patient's tumor genetics, to figure out which patients are most likely to benefit from certain medications, and to find those at high risk for developing certain diseases.
It's amazing to think we could actually prevent diseases instead of just treating them after the fact.
And I think that's where AI can really revolutionize healthcare, shifting from reactive care to proactive prevention.
It's a huge shift in thinking. Instead of waiting for people to get sick, we're using AI to help them stay healthy.
Precisely. And this is where, France's work on building that robust healthcare data ecosystem, it's really going to pay off. The more data we have, the better these AI algorithms will be at identifying patterns, predicting risks, and developing those personalized interventions.
So it's not just about the AI tech, it's about having the data to feed it, right?
Yeah.
What about the human element in all this? I hear people talk about AI replacing doctors and nurses. What do you think about that?
I mean, yeah, that's a natural concern. When we see AI doing things that, only humans used to do,
Yeah.
it's easy to imagine a future where machines take over, right? But I
Mhm.
think AI will actually empower healthcare professionals, not replace them.
So you see AI as more of a tool, right? Something that can make humans better at what they do, not get rid of human expertise and compassion.
Exactly. AI can handle those, boring and time-consuming tasks that keep healthcare professionals so busy. Things like, data entry, paperwork, maybe even some initial diagnoses. That frees up doctors and nurses to spend more time with their patients, to provide compassionate care, to build those meaningful relationships.
It's about using AI to make the human side of care even better, not to get rid of it.
Precisely. And this is another place where France's emphasis on training and education it comes in. They're not just teaching healthcare professionals how to use AI, they're teaching them to use it ethically and effectively, putting patients first.
That's good to hear. So it's not, AI versus humans. It's AI and humans working together to build a better healthcare system.
Exactly. It's about combining human ingenuity and compassion with AI's power to analyze, identify patterns, and make predictions. This kind of collaboration, it has the potential to really change healthcare in huge ways.
What else is on the horizon? Are there any other areas where you think AI could have a big impact on healthcare?
One area I'm personally excited about is drug discovery and development. Traditionally, that process, it's been so slow and expensive and it has a really high failure rate, but AI is changing the game.
I've read about how AI is being used to, analyze all this data to find promising drug candidates and figure out how well they'll work. It's like having a super-powered research assistant
Yeah.
that can sift through mountains of data and tell scientists where to look.
Exactly. AI algorithms, they can look at data from scientific papers, clinical trials, even patient records. Then they identify potential drug targets and predict which compounds will probably be the most successful. So it can speed up the whole drug discovery process, bringing life-saving treatments to people much faster.
That's incredible. It's like we're entering this whole new era of drug development. And AI is helping us find treatments for diseases that, have been around for centuries.
And it's not even just about finding new drugs, it's also about developing those more personalized treatments. AI can help us understand how different people respond to different medications based on, like, their genetics and other things. It's all about tailoring treatments to the individual.
So we're moving away from the one-size-fits-all approach towards a future where treatments are, like, unique, just like the people receiving them.
Exactly. And that's where I think the true power of AI in healthcare lies, in its ability to help us to really understand and treat each patient as an individual, not just a statistic.
This deep dive has been a wild ride. It's so clear that France is really leading the way in this whole AI healthcare revolution. What about the rest of the world? What should governments be doing to, help shape the future of AI in healthcare?
Governments, they have a super important role to play. They need to make sure AI is developed and used responsibly and that the benefits are shared with everybody. So they need to invest in research and development, create ethical guidelines, encourage collaboration and support education and training programs.
It sounds like it needs to be a team effort, right? Involving not just the government, but also researchers, healthcare professionals, industry, and the public.
Absolutely. This is such a complex issue with implications that reach far and wide. And we need to all work together to make sure AI is used to create a healthier and more equitable future for all.
Okay, I think we've really covered the main points here. Anything else you want to add before we wrap things up?
Yeah, just one final thought. As we, move into this uncharted territory of AI and healthcare, we need to remember that technology is only one part of the solution. At the end of the day, healthcare is about people. It's about caring for each other, relieving suffering, and making sure people are well. So as we embrace these powerful new technologies, we can't lose sight of that.
Well said. And on that note, I think it's time to wrap up this deep dive.
Yeah.
It's pretty amazing how much we've covered, huh? I mean, we went from the really technical stuff, data infrastructure and all that, to like the philosophical questions about what's the role of humans in a world where AI is calling the shots?
It just goes to show how complex this whole topic is, and I think France is setting a really good example, not just in how they're using the tech, but also how much thought they're putting into, like the social and ethical side of things.
Yeah, it's like they're creating this like instruction manual
Mm,
for how to integrate AI into healthcare responsibly. Something that, other countries should probably pay attention to.
I think so too. They really get it. They understand that technology is only as good as, the system it's working within.
Okay, so before we sign off, I want to leave our listeners with like a thought to chew on.
Okay, I'm listening.
So picture this. You're a patient in this future, right? Healthcare is powered by AI. What are you hoping for? Like, what gets you excited? And what are you kind of nervous about?
Oh, I like that. It makes the listener really think about how these changes will affect them personally.
Exactly. So on the one hand, you could have treatments that are designed just for you based on your genes and stuff. Maybe even catch diseases before you even have symptoms. And think about it. You could have like virtual assistants answering all your health questions anytime, day or night.
It could be a future where healthcare is like proactive, personalized, and way more effective than what we have now.
But, there's the other side of the coin too, right? People worry about their data privacy, about algorithms making, life or death decisions,
Yeah.
and about losing that human touch in healthcare.
Yeah, those are all legitimate concerns, and I think it's really important to talk about them openly. Transparency and education are key.
We need to help patients understand these technologies so they can ask the right questions and, advocate for themselves in this new world of healthcare.
It can't be a one-way street. Patients need to be part of the conversation. They need to help shape this future of healthcare.
Well, expert speaker, this has been a truly fascinating deep dive. Thank you so much for sharing your insights with us.
The pleasure was all mine. It's so exciting to see how AI is changing the world, and healthcare, it's definitely one of the fields that stands to benefit the most.
And to our listeners, thank you so much for joining us as we explored AI in French healthcare. We hope this deep dive gave you a better understanding of what's going on, what it all means, and what amazing possibilities are just around the corner.
And remember, the future of healthcare, it's not set in stone. It's something we're all creating together. One decision, one innovation, one conversation at a time.